Hello, and welcome to H&D's Postpartum webinar. I am Guia Sheker, and I am the Director of Pelvic Health for H&D Physical Therapy and your host during this time. During our webinar, we'll be discussing the anatomy of the pelvis and its relationship to the rest of the body. Then we will move on to talk about one of the treatment modalities we use in the Upper East Side Clinic and how it is used in the treatment of diastasis recti, scars, and pelvic floor strengthening. In our next section, we will talk about the hormones and its effects on the body, along with the appropriate bra fitting during this time of change. To end, we will have one of our therapists, Kathy, talk about efficient body mechanics and safe exercises for the postpartum population. Unlike any other group of muscles, the pelvic floor works best when they are interacting with other groups of muscles. We're going to address how the hip and the trunk muscles and the rest of the pelvis work together. Looking from the top of the pelvis to the bottom, the pelvic floor muscles are a group of circular-shaped muscles that when they contract, they close the urethra, vagina in women, and the anus. The pelvis is home to other muscles and joints. The hip joint joins the pelvis to the thigh bone. As the hip muscles contract, so do the pelvic floor muscles. Their proximity to each other allows them to affect the other. All the muscles that are attached to the pelvis works together like a team, which makes the hip muscles and the pelvic floor muscles partners in function. Did you know that the pelvic floor muscles are also core muscles? The deep core muscles are actually a group of muscles in the center of the trunk that, when working together as a group, have multiple functions, one of which is core stabilization. One of the deep abdominal core muscles, called the transverse abdominis, has a direct function in pelvic floor muscles. The bottom of this muscle attaches along the top rim of the pelvis. In order for the pelvic floor muscles to function correctly, it needs the transverse abdominis to contract at the same time. Exclusively at our Upper East Side Clinic is the Windback. There is a diathermy modality that uses high-frequency alternating current to enhance the molecular processes involved in healing. It is used in physical therapy as a therapeutic modality, as well as in the beauty industry for skin improvement. The current from the Windback induces movement of the ions and molecular activity to enhance cell metabolism. The Windback is used to treat scars, diastasis recti, and prolapse. It is also used to aid in pelvic floor strengthening. So there are three effects: the cellular effect, or the non-thermal effect, the thermal effect, right, and the high thermal effect. In the cellular effect, what we're getting is the Windback energy causing the flow of ions with fast electrical oscillations within the cellular environment. These oscillations of ions result in increased cellular metabolism, which means that increased oxygenation and removal of toxins. Thermal effect comes from the ionic agitation generated between the electrodes. The friction of the ions with each other causes an internal heat production. As the intensity increases, the quality of the ions between the electrodes increases, thus increasing the temperature of the body. We can break these effects down into three groups: the non-thermal, or the cellular effects, and the analgesic effects that are derived from the improved cellular metabolism, increased oxygen exchange, and removal of toxins. Strong thermal effect, which further improves oxygenation due to vasodilation, increasing tissue temperature, results in improvement in muscle spasm as well as stronger contractility for weak muscles. The hypothermia effect, or the high thermal effect, stimulates collagen synthesis and neovascularization, resulting in improvements in tissue strength and elasticity and scar tissue removal. The key point with the Windback is that it can be used on scars on the first day, including perineal scars. It works on new scars by stimulating cellular metabolism, promoting analgesia and drainage of edema. It promotes the formation of a better scar, since Windback is Applied at the same time as gentle massage, it stimulates tissue to be built with good alignment and prevents formation of adhesions. As at higher temperatures, it improves old scars by promoting neovascularization and formation of new collagen, thus improving the elasticity of the scar. Since scar tissue has improved elasticity, this would also improve the contractility of the tissues, thus improving pelvic floor function, or in this case, abdominal function with C-section scars. As the baby is growing during pregnancy, the rectus abdominis can separate at the midline of the body. A separation is considered pathological if it is 2 to 3 centimeters. 27% of women in the second trimester and 66% of women in their third trimester have a diastasis recti. 66% of these women continue to have the diastasis recti after delivery. For diastasis recti, we use Windback at higher temperatures to promote the formation of new collagen that will improve the stiffness of the Lumina Alba. Used concurrently with abdominal exercise, we provide the right stimulus to the fascia as well as to improve strength in the abdominal wall. Abdominal training with the Windback uses both non-thermal and thermal effects. The non-thermal effects are improvement of cellular proliferation and the stimulation of the synthesis of new collagen, which increases the tensile strength of fascia. The thermal effects include increased blood flow for the tissue hydration, improved muscular contractility, and improved appearance of the skin. The Windback can also be used in conjunction with pelvic floor muscle strengthening. It provides biofeedback by heating the tissues and improved proprioception to increase the muscle contraction. Despite the integral role of estrogen and progesterone in the preparation of lactation, both inhibit milk production. Colostrum is secreted into the ductal system on the final days of pregnancy, but at the rate of only a few millimeters per day. Milk production at full capacity begins at childbirth when the stimulatory effects of prolactin act unopposed to the inhibitory effects of the placental estrogen and progesterone. Secretion of prolactin from the pituitary gland steadily increases throughout pregnancy, but returns to the basal levels postpartum. Milk synthesis is sustained by each breastfeeding event, which stimulates biofeedback, resulting in high-level intermittent prolactin secretion. A correctly fitting and supporting bra is essential to good health, and it can alleviate breast pain, allow women to exercise in greater comfort, and reduce the need for breast reduction surgery in the future. Especially with both of the mentioned populations, the rest of the female world, sports bra fittings as well as regular bra fittings should be a regular occurrence. So in trying on bras, make sure that the band is not too tight, that your flesh is not bulging over the top of the band, or that the band moves when you lift your arms overhead. Also make sure that there are no wrinkles in the cup fabric or that there is no breast tissue bulging above or below or even at the sides. Make sure that the straps are just right and don't dig in and fall, or they even fall off the shoulder. So now I would like to let my colleague Kathy take over to discuss the body mechanics and exercises for the postpartum population.
Good body mechanics refers to the correct positioning and movement of the body during various activities to minimize strain, prevent injury, and optimize efficiency. Here are some key points for maintaining good body mechanics while lifting. Maintain proper posture. Stand with a straight back, shoulders relaxed, and head aligned with spine. Stay in a tall, neutral alignment and keep the muscles of the lower abdomen pulled slightly up and in. Use a wide base of support. Keep your feet shoulder width apart to provide a stable foundation and maintain balance while lifting. Avoid twisting and reaching. Instead of twisting your body to reach for something, you want to face the object. Get as close as possible and keep the object within your arm's reach. Lift with your legs. When lifting objects, engage or contract your pelvic floor and core muscles. You want to squat to pick up the object, bending your knees and hinging from the hip. Maintain neutral spine and remember to breathe as you lift. You want to do the reverse on the way down. General recommendations for exercise for postpartum women. It's a gradual return for all women, immediate return if no pregnancy or birth complications and it's medically safe. If complicated vaginal or cesarean birth, wait until 6 weeks or after postpartum examination when your doctor clears you. Pelvic floor exercises are important to strengthen the muscles that support the bladder, uterus, and bowel. These muscles may have been weakened during pregnancy and childbirth. It's hard to demonstrate Kegels or pelvic floor contraction exercises here, but it's highly recommended. Kegels, squats, and bridges can help strengthen the pelvic floor muscles. Abdominal strengthening exercises after childbirth are very important. Abdominal muscles may be weakened or stretched, which can lead to back pain and other problems. Strengthening exercises can help improve core stability and reduce the risk of these issues. Resistance training such as weightlifting or bodyweight exercises can help improve muscle strength and function after childbirth. It can also help with weight loss and improve bone density. Bridges target your gluteal muscles and also work your core, hips, and thighs. Line your back with your knees bent, feet flat on the floor, hip widths apart, facing straight ahead. Arms at your side with your palms facing down, back glued down to the table. Head, shoulders, neck relaxed. Take a deep breath in, and as you breathe out, you're going to squeeze your butt muscle like your $100 bill between your butt cheeks and lift your hips up towards the ceiling. When you lift, you want to make a diagonal line between your knees, pelvis, and trunk. Keep the glutes squeezed, especially as you lower down. Bridges can have up to a 52 activation of pelvic floor muscles. You want to hold for 10 seconds and do 10 repetitions. Planks are a simple but effective exercise that can help strengthen your core muscles. Start on your stomach, on your elbows. Make sure your elbows are directly underneath your shoulders, your head is neutral. Tuck your toes in like you're doing a push-up. Draw your belly button up and in. Pull in as you lift your body off the table. Make sure that your butt is not in the air. You want to tuck your tailbone in, draw your stomach in, and you want to pull those shoulder blades down and back. Lift your head up to neutral and hold it for 10 seconds. You want to make sure you're feeling this everywhere but your back. If you feel your back, you can drop down to your knees or shift the weight to your toes. Squats can help to improve lower body strength and stability, which can be beneficial for postpartum women who may experience back pain or pelvic floor weakness. Squats work your gluteals, quadriceps, and core muscles. Start with body weight squats. A study found that squats can activate pelvic floor muscles up to 30%. Stand with your feet hip widths apart, glue your feet down to the ground, dig your heels in. Keep your trunk upright as you pretend there's an imaginary chair behind you. Hinge your hips back, bend your knees, and squat down. Try to feel this in the front of your thighs and even in your butt muscles. You want to hold this for 10 seconds. On the way up, you want to dig your heels in, push through your feet, and stand straight up. You want to do this for 10 repetitions.
Thank you to the whole team, to the whole pelvic floor team for their knowledge and input on this webinar. And thank you everybody for joining us on this webinar. We hope to see you again in a future webinar. If you live in the Park Slope area, please come by with your baby and for a free alignment and body mechanics assessment.